Good day, and thank you for joining us for today's webinar as part of the series Planning for Sustainable Financing. We'll get going in just a few minutes. We'll wait for another couple participants to join. Thanks again for your time. Okay, why don't we get started? Hello, good day. My name is Melinda Frost, and I'm the unit head for Learning Solutions in the WHO Health Emergencies Program at headquarters. Today, we're helping to host this program and one in a series of webinars for WHO's community of planners, planning for sustainable financing. Today's program will focus on developing prioritized and costed plans. The purpose of this webinar series is to assist countries in developing a successful national plans or proposals on sustainable financing for emergencies, health emergencies, particularly focusing on the current pandemic fund second call for proposals. We hope that this webinar is really reaching programmatic managers, proposal writers, or grant writers at country level that are seeking to improve their proposals for sustainable financing within your country, Ministries of Health, multi-country teams, and among others. The specific objectives for today's session on developing costed and prioritized plans include highlighting how countries can build on the IHR-related plans to inform prioritization and costing of activities within the pandemic fund country proposals, multi-country proposals, etc. And then share how countries can review and build on existing costing tools as they develop their national plans and country proposals. And then to discuss how global strategies have been adapted and applied at country levels in the Africa region as an example to inform the development of country proposals and plans. So with that, I think we can get going today. We are taking account of your questions and answers. So if you have any questions today, please go ahead and insert them in the Q&A function on your Zoom account. We have collected the questions that have been sent in prior to today's, and we will be proposing those to the panelists. Following today's program, we will pull together frequently asked questions and share those question and answers back out to you, as well as any of the tools mentioned today, the PowerPoint presentation, and a link to today's webinar recording. Okay, if we could go to the next slide, please. Today, we are joined by a number of expert speakers from WHO and always with partnering organizations as well. We'll be hearing from Fred Copper, who's the Technical Officer for Health Security and Preparedness. Also Nirmal Kandal and Ian Yoon to hear more about evidence and analytics and health economics and how to approach those in your proposals. And then finally from Roland Wango, who's a technical officer who focuses on national action, public health and security plans or national action plans for health security in the WHO Africa Regional Office. So with that, I'll turn this over to Fred. Thank you.
Yes, thank you, Mindy, and good morning, afternoon, and good evening to all of you joining us online. I do apologize because my camera is unfortunately not working, but you can see my picture there, so you can imagine how I look like as I'm talking to you during this webinar series. If we can go to the first slide, I'm going to talk a bit about the NAPS. And for those of you who do not know what the NAPS is or have heard about the NAPS but not quite sure what it entails, the definition is stated on the slide. But basically, NAPS, standing for National Action Plan for Health Security, is a capacity building plan that aims to strengthen the capacity and capabilities of countries to prevent, detect, and respond to public health events. This is a One Health multi-sectoral planning process, and it's a national plan, meaning that these plans are developed by national stakeholders and also owned by national stakeholders. And this is very important to note. And in today's webinar, I'm going to talk a bit more on how the NAPs can be used to coordinate some of the existing and future resources. And in particular, I'm going to talk about how the NAPs can be utilized for the second call of proposal for the pandemic fund application. Next slide. So just a bit of a background on the NAPs, and for those of you who did miss last week's webinar, there was already some webinar on the IHR, the International Health Regulation. And since the NAPS is an IHR capacity building plan, its mandate also comes from the IHR. Because in the IHR, it's actually stated that every country shall develop, strengthen, and maintain the capacity to detect, assess, notify, and report to events in accordance with the IHR. So the NAPS being an IHR capacity building plan is, of course, its foundation, and having this as the foundation for the plan's development is very important to note. Next slide, please. And if you can click on a few, yes, thank you. So basically, the NAPS has as its foundation uses either the SPAR, the State Party Annual Reporting, which is an annual self-assessment done by countries, or the JE, which is a voluntary joint external evaluation, and which is done every 4 to 5 years, as the foundation, as the basis for the plan's development. And we will see in a bit, but the SPAR and the JE have 15 and 19 technical capacities, and activities are built around those technical IHR capacities. Also, risk assessments and after-action reviews and simulation exercises feed into the NAPS. By including the risk assessments, the NAPS becomes a risk-informed planning process. The benchmarks, which my colleague Nirmal will talk a bit more about, as well as Roland, is a very useful tool that has a list of suggested actions already pre-developed that countries can adapt and based on the context of the country, use for their NAPS development. And all of this is really used as the basis foundation for the NAPS development. As mentioned, the NAPS is a One Health plan, including multi-sectorals. So it's also very important that this planning process is not just being developed and implemented by the Ministry of Health, but also includes other key stakeholders, including those One Health stakeholders. Next slide. So in this overview, you can see the number of NAPs developed globally. And here you can see a difference between strategic NAPs. So these are high-level 5-year plans, as well as shorter operational plans. So these are normally 1 to 2 year operational plans that are developed. And this is really helpful for countries to manage and implement activities. In the past, the NAPS has always been the high-level 5-year plans, and these have been seen as a challenge to really track and implement those plans. So in the last few years, operational plans are more and more used by countries to really track implementation, get the funding to really start that implementation and monitor the impacts these plans have. And as you can see, in all the 6 of WHO's regions, there have been NAPs developed. The African region has been the biggest number of countries where NAPS have been developed. And this is also the reason why my colleague Roland will talk a bit more on the Afro experience and how the NAPS can be used for your pandemic fund application. Next slide, please. So how can the NAPS be used in the pandemic fund call for proposal? So first of all, in the part B of the application proposal, there is the rational demonstrated need and alignment with national and regional priorities. And here there's actually a table 5, that has a direct link to the NAPS. And as you can see, I've pasted that in this slide. Here you can see if the country has developed a 1-year operational NAPS. And if so, you can add that information in your application template. Next slide. So how can countries use the NAPS for their new funding proposal? There are 3 options, and this depends on where the country stands in their NAPS. The first option is if your country has recently developed a NAPS, then you can use that and extract the information for the pandemic fund proposal. And I'll show you in the next few slides how you can do that. If your country has a NAPS, but it's outdated, then the option is to quickly review that plan and update it according to the NAPS tool so that you can use that in your proposal. And the third option, if you don't have any plan in your country, then you can quickly review your SPAR or JE assessment data to develop a 1-year operational plan that can be then used for your pandemic fund proposal. And on all these 3 options, I'll just briefly tell you how this can practically work in your country. Next slide. So in the first option, if you have a NAPS developed, and this is quite recent, then what you can do is basically extract the key information according to the 3 priority areas of the pandemic fund. So as the NAPS, as I mentioned, is built as the foundation around either the SPAR or the JE indicators, you can extract the key activities under the 3 capacities of the pandemic fund priority areas. So as you know, in the pandemic fund, they're looking at the national laboratory, they're looking at the surveillance component, and they're looking at human resources. So if you have an apps, you can quickly extract the information from these 3 capacities and put that in your pandemic fund application. So that's the first option. Next slide. If you don't have a NAPS or it's outdated, then you can quickly review your plan, and you can also quickly assess the assessment from either the SPAR or the JE. If you can click 2 times. Yes, thank you. So here you can see the assessment. So as in last week's webinar was mentioned already, every country has recently submitted their SPAR, their State Party Annual Reporting, which is a self-assessment, and this uses those 15 IHR capacities. So you can actually use the capacities under the surveillance, laboratory, and human resources to quickly develop a NAPS. If you click the next one, this information is then used to develop a 1-year operational plan, and then you can also cost or estimate the cost for your activities. And my colleague Nirmal will talk a bit more about the costing in a bit. So all of this can be done in 2 to 4 weeks. And it's basically to help countries come up with a prioritized list of activities according to the 3 priority areas that the pandemic fund is focusing on. Next slide. So the NAPS tool can be useful to actually help you extract that information. And this is really a straightforward and easy to use planning tool. As I said, it is using the JE or the SPAR indicators that is also used for the Pandemic Fund monitoring framework. And this will help in terms of the monitoring of activity implementation. As I said, the NAPS has the distinction between the 5-year high-level strategic plans and the 1 to 2-year operational plans. So the tool actually has an option to develop both of them. And of course, for accountability, the responsible person and timeline will be also tracked in this tool. Resources can be identified as well as the costing, and the actions can be prioritized. And if we can click on, sorry, one more. This doesn't look great. I'm sorry for that. It had to be actually a visualization of the NAPS tool itself. So we'll have to just fix this, and we will send you the correct visualization. But it's basically just a visualization of the Excel tool itself, where you see the different cells that countries can fill. And they're basically what I just mentioned: the responsible person, the timeline, the resources, the costing, but also, of course, linking this back to the IHR capacities, being either the 15 of the SPAR or the 19 of the JAE. And with that, I think the last slide is just a quick summary. So basically, you can use the NAPS for your pandemic fund application. This depends on the planning status of your country. And here you have 3 options. If you have a NAPS recently developed, then just use that to extract the information of the 3 technical areas for your pandemic fund proposal. If you have an outdated NAPS, then just quickly review and update this. And if you have no NAPS at all, you can use your recent SPAR or JE data to quickly draft a plan for your pandemic fund application. So in summary, those are the 3 options, and that's how you can practically use. And the NAPS Excel planning tool is available through the link also in the next slide. And I'll stop there and thank you all for your attention. And I'm happy to answer any questions or clarifications. Thank you. Over to you.
Great. Thanks a lot, Fred. I think that was very, very clear. Even if we couldn't see you, it was still crystal clear. So thank you very much for the time. And please stick around for some questions. In a moment, we'll be moving on to our next set of presenters. But before I do so, there were a number of questions regarding translation, particularly in French, I think I saw, and also how people can get the resources from this webinar series. We are, just to let you know, working closely with our regional counterparts to really help make all of these materials available in other languages. We have to really depend on our regional offices to really help support us in this front. And then I think in terms of the ongoing resources, the recordings from past webinars, Q&As, different tools, and these PowerPoint presentations, you should expect an email probably from WHESPP at who.int within the next week with all of these resources listed. So just stay tuned a little bit longer for that. Okay, with that, I think you can switch it to the next slide, and we'll move over to our 2 colleagues, Nirmal Kandal and Ian Yoon, to talk really about building on existing costing tools to inform your proposals. Thank you. Nirmal and Ian.
Thank you, Mindy. I'll start on a benchmark and hand over to Ian to talk on the costing component. And thanks, Fred, for setting the scene. And I'll start from where Fred left when there is no recent NAPS or outdated NAPS or on the process of developing NAPS. This is where the benchmark tool can help assist you to develop the pandemic fund proposal. Next slide. On the first round, if you recall, we did quickly finalize the those pandemic fund priority areas of the benchmark, those technical areas, and upload it. But the good news is that now we have a finalized, updated version of the new benchmark, which we call WHO benchmark for strengthening health emergency capacities. It captures IHR capacities as well as the health emergency prevention, preparedness, response, and resilience capacities. And as you all know, this is a list of benchmarks that are required to sustain IHR and HEPR capabilities, a list of actions that can increase these capacities, and these are informed by technical experts. More than 250 contributors contributed from various agencies and government, and it aligned with IHR monitoring evaluation tools, HEPR architecture, lessons learned from the recent health emergencies, health system for health securities, as well as the disaster risk reductions. The document is very heavy with the 400 pages, but this document comes with an online portal which is user-friendly. You can navigate the benchmarks, and you can use it to draft, facilitate the planning process, and it has a reference library as well when you are implementing these activities. Next slide. This is a quick overview of the technical areas, and you can see those new technical areas, new benchmarks, and those technical areas that are updated. We have learned so much of things from the recent emergencies, particularly from COVID-19. So we have captured other technical areas that are necessary in order to strengthen health emergency capabilities. Next slide. So these are in a different capacity level. These are suggested actions to move from one level to another. And if the country is in level 2, if you don't have the latest plan or roadmaps or NAPs, I'm sure now all countries have a latest SPAR, and they can use that information. If the country is in level 3, they want to move to level 4 or 5, they can use this point as a reference document to develop their actions or activities according to the country context. Next slide. So I would like to highlight these 3 technical areas: national laboratory system, surveillance, and human resource. You can select in the portal also the specific technical areas that you want to develop, which I will show it, but as well as there are surveillance in other technical areas also, like food safety, AMR, zoonosis, points of entry. Similarly, those related to risk communication and IPCs, which are also used as a priority areas for the pandemic fund proposal. So you can access those from the portal as well. Next slide. So how to use the portal? This is a screenshot of the portal. If you have a latest score, let's say level 2 for your countries, you can select the technical areas, and you can set your target, and it generates the list of actions that can be used for the proposal. Just to remind that, please contextualize these actions with your latest risk information and latest country profile. It's necessary to contextualize these actions also. And in the portal also, you can edit that also, but you can generate that one and work in a working group or technical working group also. The one beautiful part of the portal is that you can identify the duplications in the activities in various technical areas, and the 2 graphs that you're seeing on the screen actually highlights where are the potential duplications. So you can click and look at and remove those duplications or triplications, so that it will increase the efficiency and the effectiveness also. Next slide. So this is the reference library, which will be more useful when you are implementing those actions. So it can be accessible in the portal as well. So with this, I will hand over to Ian. This is my last slide. So my colleague Robert, who will take answer on the portal, and if there is anything on the benchmark, my colleague Lina, you will respond, because I have to leave for another urgent meeting. So I apologize for that one as well. So over to you, Ian. Next slide.
Thank you, Nirmal. Good afternoon, everyone. My name is Ian. I'll just be extending a little bit on what has already been covered in terms of using existing plans, regardless of whether they are NAPs or benchmark plans, even existing national health plans that fall outside of the remit of those two can be utilized for pandemic fund round 2 applications, as long as they fall within the constraints of the areas of interest, including surveillance, lab systems, and health workforce capacity. Operationally, in order to move those existing plans into the application for the pandemic fund, we do have a costing tool available on the partner platform where the tool aggregates those existing budgeted activities and then exports into the formats needed for the pandemic fund application. But this is not to say that we only need to stick to new planning, really just to highlight that existing plans can definitely be leveraged for your application. Yeah, that's all from my side. Thanks so much.
Okay, do we have another slide left in this presentation, or is this the end? Okay, great. Why don't we move over to question and answers for just one moment before we go to the third part of our segment for today. I think you can stop sharing slides for just a moment, please. Okay, great. We have a couple questions already, and I'll pose these to Fred and Ian. Ian, the first question, how can we know the exact cost for national health emergency plans? For example, how can we plan or approximate budgets for it?
Yeah, I think it's a great question and a very difficult one. Obviously, it depends on the specific country context and the idea that there probably is no exact answer. I think what WHO is advocating for is both within the NAPs and the benchmarks that these can be, I guess, starting points or outlines for what might be required for a health system to respond to a health emergency, but obviously not entirely comprehensive. And while the activities that Nirmal showed within the benchmarks are relatively specific, the exact budget depends on the country context, what are those specific costs needed to implement each of the activities within the levels of the benchmark. So yeah, I don't know if that's a very satisfying answer. I can't tell you it's $1 million exactly.
Oh, yeah.
But
very difficult. But that's potentially a good answer. And then I suspect that countries that can then also turn to their regional counterparts for additional assistance on that as well. Okay, so the next question we have is actually for Fred. Fred, after how long can a NAPS be considered outdated? Like how long is the information in a NAPS good for?
Yeah, so here, of course, as I mentioned in the presentation, there's the differentiation between the 5-year high-level strategic plans and the 1 to 2 year operational plans. So the timelines are 5-year versus 1 to 2 year. And it depends whenever the country has started the NAPS development and when these timelines are over, then that's outdated. Now, having said that, many countries have recently updated or done a new JEE. So last year we had around 30 countries doing a new joint external evaluation. And many of these countries are now updating their NAPs based on that recent assessment. So I think that is the answer to when the NAPS is outdated or needs to be updated. But of course, the state party annual reporting tool, which is done on an annual basis, can also be used and can and should be used to update your plan on an annual basis. Thank you.
Okay, great. And I would say actually, Fred, similar to that question, just for clarification, for countries that don't have a NAPS or have an outdated NAPS, one that was, I guess, considered done before COVID-19 would be a good example. How can countries proceed with developing prioritized activities and costing in their pandemic fund proposal? Maybe beyond SPAR and JEE results, are there other, I guess, data that can be considered in their application?
Yes, very good question. Absolutely. Thanks for the question. So beside the SPAR and the JE, actually, there's much more data and assessments that country have, and there is no limit in that sense. But some examples of recent NAPs that were done in countries and the type of data that was used includes also some of the One Health data. So here you must think about the IHR PVS national bridging workshops, for instance, but also the wider health sector assessments. Also risk assessments are critical to include because they also often have priority actions already identified. Then we have the more qualitative assessments, so such as the functional reviews, the after action reviews, interaction reviews, but also the simulation exercises. So I can go on and on and on because there's much data and much assessments available. But as the basis, the SPAR and the JE is used, and then any other recent assessment data that a country has can be used to feed into the NAPS development process. Over.
Perfect. Okay, great. Thanks a lot, Fred. I'll just have one more question for Ian, and then we'll move on to our colleague, Roland. Ian, for costing activities and initiatives in the pandemic fund proposal, what example from maybe national resources or methodologies could be consulted and applied?
Yeah, I think the strength of the pandemic fund application is always dependent on if the budget proposed can be justified. So, all different methodologies of costing are obviously valid, but some are more justifiable than others. So, starting from top-down methodologies, again, a lot of countries use this type of costing at a very broad level, more for resource allocation decisions rather than operational decisions, all the way moving towards something like an activity-based costing, which I think both NAPS and benchmarks utilize. I think building those budgets from the bottom up, from individual inputs into actions all the way up to the 3 levels around the pandemic fund application is going to be the most justifiable. Yeah, I think those are well documented in various costing literature, and happy to share links for those different methods with the group.
Perfect.
Thanks.
Okay, great. Thanks a lot, Ian. Next, we'll go to our colleague, Roland Wango. Please, Ian and Fred, stick around. We may have some questions towards the end of the program that may relate to you. So thank you in advance. Okay, great. Roland is going to talk to us about adapting and applying global strategies to inform country proposals and share his experiences from the Africa region. Roland, thank you.
Thanks, Melinda, and good afternoon, good morning, depending on where you are. Yeah, I'm going to walk us through what Fred and Nemo and Ian have all talked about and what we did in Afro. And you saw in Fred's presentation, we have quite a bit of the NAPs developed over time. Next slide, please. When we considered the NAPS right from its beginning, we decided that it was about time for us to structure the development and implementation. So we got to mobilize our partners and colleagues in HQ. So we should come around, and we developed a NAPS toolkit. We've officially rolled it out this year, 2024, actually end of last year, and we're using it already in about 6 countries. But before that, it's been implemented in a lot of the countries on the continent. It's just that we've put together all of those tools that are available, the benchmark, the costing tool, and of course, using the now published NAP strategy, the global strategy, which is very much aligned with what we are doing. Next slide, please. And looking into the toolkit, we had what we have from the NAP's global strategy, NAPS for all, right? It had all the flexible steps, templates, and guidance into how to develop your NAPs. The additional aspect here of the toolkit, which we're going to look a little bit into, is monitoring its implementation, managing its implementation, and updating it regularly. Next slide, please. So the principles of governance, systems, and quality improvement are the basis on which this toolkit was developed. We are trying to bring all of this together so that we get our countries to not just develop a NAPS and tick a box, but to actually consider it as a governance tool, as a place where various multi-sectoral, multi-dimensional, and the health system in its integrity come in order to ensure that public health emergencies are well prepared for in various countries. And the quality of improvement comes with the constant monitoring and the tools available within the toolkit for that quality improvement and quality control. Next slide, please. So if we go into some 5 dimensions here of our toolkit, which are very important for us, just to give you the overview, we have the dedicated preparedness teams. What's happening here? We want to identify a core team that's responsible to ensure that the NAPS is developed, but also it's implemented. We have identified technical area leads, and we also have high-level decision makers. This makes a combination of that core team. So while we're going from technical, managerial, but we're also looking at decision makers sitting on that core team so they can support the processes when implementation needs to happen. Slide, please. And the second aspect, now socializing systems. Then the NAPS naming the cyclical nature of the whole process is what we're demonstrating here. Some of that and more detail was done during Fred's presentation, but if you look at it simply, we want to develop, implement, and assess. It starts with JESPA, which are assessments, but there are also other assessments that we require, especially when it comes to the operational planning and midterm reviews and things like that. So all of that cycle needs to continue turning in order for the NAPS stays alive for 5 years or 1 or 2 years, depending on which strategic or operational, but then it doesn't really expire because we found ourselves with activities that are not completed. So every time we do an assessment, we rebirth the NAPS, so to speak. Next slide. If we get to a third option here, one of the tools in this toolkit is to ensure that we are using all the tools available, various analyses during implementation, during assessment. We do lots of synthesis because we have to do prioritization. If you dig into the benchmark, it's a reference document. You'd see lots of good stuff, but how much of that can you do within your country? How much of that can you adapt to fit the recommendations from your assessments? That is the kind of exercise that happens during this stage. So we support that quality planning and informed by implementation data, which means that you've done some cyclic assessment in order to come up with recommendations. 2 to 3 priority per technical area. If you have the JE, the SPAR, stimulation exercises, after action review, the list is long. Fred gave quite an exhaustive one. Next slide, please. If we take a simple example here, I'm going to go through this quickly. National legislation, policy and financing. This is based off of the J 2.0. Next slide, please. So one of the things you'll be doing here, we want to compile and review reference data, what exists when it comes to this technical area in terms of information that need to, gaps that have been identified. Next. Yes, next slide. Yeah, thank you. So if you're looking at a review of your previous maps, you have a series of activities, and this is part of the image that was hidden behind some of the text Fred was presenting, but it looks like this. So you're looking at your plan, and you have an assessment. You've completed the different levels of completion. Some have not started. This is an assessment. Next slide. You come into your recommendations. What do you have as recommendations? Where is this recommendation coming from? How is the risk event associated evaluated during this? So this is an exercise that continues with reviewing recommendations from various assessments. It's in line with prioritization. Slide, please. It comes into the benchmark, comes in here, J targets, SPAR scores. We look at where are we based on our current status from the recent assessments, whichever one you're considering that's valid and up to date for you. Where do you want to be down the road? And that's where you see the different scores. If you're looking at JE or SPARS, we have the 5-tier scoring for those assessments. And we tend to link each of the activities or recommendations from various sources to identify which indicators within the JE or SPAR are linked to those recommendations, because at the end of the day, we're building capacity, we're building our IHR implementation. So we need to be able to contribute, take all the contributions from various interventions and link them to these other assessments, which are more quantitative and popular, if not say, the SPAR, which is actually obligatory. And if you make those links, it helps you know how you're improving your IHR core capacities. Next slide, please. If we get into the next 4 to 5 steps, prioritization of all those assessments that you're doing. Next step, please. Now you get to a point where you have this prioritization, the various criteria, impact feasibility metrics. We use that to determine which strategic actions impact feasibility and all of that. After this exercise, it's easier to determine what goes into my operational plan now and what can wait for next year or the next couple of years, depending on the impact and feasibility. We determine the priority level for which activities, and then we get into especially when we were coming into operational planning. Next slide, please. When we are finished, we have our activity, we have our detailed NAPS activity, and we have responsible focal person. You can call a project manager or something. So this is a presentation that you have, and it's a summary and it's a snapshot of what looks. There are many other columns involved here, which we just did a snapshot just for you to understand what it looks like when you are finalized your actions and you have draft activities. Next slide. So if we get to the 4th level, we are enabling synergy between various interventions, various sectors, various other country assessments, planned health sector development plans, and avoiding redundancies among technical areas. So creating functional groups would enable us to make that connection. In the JE, we have what we call a heat map, right? We see the linkages between various technical areas, and it makes it easier for us to have these functional groups, same people working within similar technical areas, and they can work together and limit the number of activities that go into your NAPS, but also the number of resources needed for implementation. And all of these were within the HEPA 5Cs, which we've seen in previous presentations. So we are looking the prevent, detect, response, and under the JE pillars. fall under these 5 C's in the HEPA strategy. Next slide, please. One of the important things here is our routine implementation monitoring. Bottleneck analysis approaches is what we really use. What have we done? How far we've come? What are the challenges for activities that have not started, that are stuck or maybe redundant? What we do such an analysis, and then we streamline for the next year for operational planning. And even if we are just doing a midterm review of our NAPS, as an opportunity to course correct and as we move forward. Next slide. I think I'm rounding up here. Thank you.
Great.
Melinda,
Thanks a
over
lot.
to you. Yeah.
Yeah, thank you very much. Very, very clear. Thank you for the time and the presentation. So we'll go for a couple of questions and answers right now. First couple will, of course, go to you, Roland. The first one is for countries that received funding for the pandemic fund first call, what were some of the best practices they applied for costing?
So one of the things we have in the toolkit is the NAPS planning and costing tool. It's integrated for all the activities that we identify using that tool. We have cost estimates that are made and attributed to each activity, which means by the time you finish developing your NAPS, you know exactly what it's costing you for each activity, for each strategic action, which regroups a set of detailed activity for each objective and for each technical area, which makes it easier to tease out an operational plan or tease out a proposal, which is, for example, the pandemic fund, specific technical areas. You can go in there and do a prioritization exercise if you don't have one that is current, and then you have something to submit, which is already costed. One of the things you can do really quickly using that tool is adjust for current cost estimate. Once you tease out what you want to submit, you can use the same tool and revise your either exchange rates and things like that, and it brings you closer to your cost estimate. And for those 5 countries, it so happened they have NAPS that were alive or had recently conducted a NAPS review for end term or midterm. It brought them back to, again, like I said, a rebirth of information and data that was ready to be submitted.
Okay, great. I really appreciate how much you know in detail how that worked within the region with countries. And maybe building on that previous answer, could you potentially provide an example of how NAPS developed at a country level was used to inform the proposal development for the pandemic fund? Maybe give one specific example and what were the steps involved?
Right. So Zambia, Burkina Faso, and I'm Ethiopia right now. I'm in Ethiopia. We're updating their NAPS. It's a typical example of a country where the processes and Zambia and Ethiopia piloted the toolkit way before, and it was so timely when it came for their pandemic fund proposal development, because they had lots of information. In fact, it was just the limit of the amount available that you could award for the projects that they got. It's not the limit of how much they could request for. So it makes it a lot easier and faster under that time frame to come up with some good quality with linkages already established following those steps I was talking about. Because if you're going to the pandemic fund platform, they're asking for those linkages. How is it linked to the JE or SPA? What assessment is your proposal linked to? What indicators are your reference, your plan reference to? And if you had that exercise done already, it's a matter of quoting it and picking up information from there. So those 2 countries did a great job because it was just a timely opportunity for them to have just finished such an exercise.
Great.
Over.
Okay, good. It's nice to see these M&E tools really be used for something I mean, not that they weren't before, but really concrete and really, really then driving home
Yeah, it's coming alive. coming alive.
Yeah, it was nice. Okay, great. Thanks so much, Roland. Just wanted to pay note to one comment, and then I'm going to the last question to be answered by somebody on Nirmal's team. I think that might be Lena if she's available. So there was a comment made in the chat about workforce capacity being vital in this tool management process throughout the pandemic fund. I just wanted to point out that, and we'll announce it in a moment, there will be an entire week, I think the week of April 8th, where we'll dedicate a number of different webinars to specific technical areas, and there'll be one dedicated to the workforce capacity area. So just stay tuned for more detail coming down that direction. Finally, one last question. I think again, Lena or somebody on Nirmal's team, and it has to do with regarding the benchmarks within the pandemic fund application. How can this be approach or tool be used to inform the selection of strategic priorities, objectives, and activities?
I'll take that question. Thank you, Melinda. As Nirmal shared in the slides, so please use the benchmark online portal. I've also put the link in the chat box. So clearly, this development of these plans and selection of actions will build on the existing G and SPAR score. And based on the score, country can also set their goal where they want to go from level 2 to level 3, and will provide a list of recommended actions. And for the new benchmark, we have more than 20 technical areas and have almost 2,000 of actions that cover all the technical area and range from level 1 to level 5. So country can really, based on their own needs, to select this action as per each of the area. And the online portal also allow a function to develop a area-specific plan. And based on that, if you go to the second page, the portal also allow another function is to either filter the action or delete the action as per the need. And after all these click done on the portal, it's quite easy within a few minutes. After all this work done on the portal, country will have a draft plan with the hand. They can use it to discuss with the stakeholders in the country state through a workshop. That thus will support them further to finalize and develop the plans. Thank you.
Okay, very clear. And I hope people can get to that tool. And thank you for the link. If not, we'll be sharing that following the program today. It sounds very handy. I think we just have one more question, and then we'll close out today. A critical question coming through for either Fred or Roland. Can NAPS be put as actually an activity in the pandemic fund proposal if a country hasn't actually yet done that? Is it possible to put in this or any other maybe M&E approaches, activities that need to be done? Fred or Roland?
I'll take a stab, and Fred, maybe you can complement. I think from my experience, in your proposal, you should have an M&E framework for your proposal. And NAPS and the activities are linked to your NAPS, at least the case of the Afro experience. Our activities are based in the NAPS or linked to the NAPS one way or the other. So yes, if you have your NAPS operational, an operational planning or a NAPS review workshop and subsequent planning, of course, should be an activity in your framework when you're developing your plan. So I don't see any reason why not. The challenge is if you want to develop a NAPS, then that would be an issue. You might have to explain what's going on there, because normally you should be making a link to some existing plan, and that's how your proposal is coming through. But you should use your NAPS review workshops as a basis for monitoring the implementation of your pandemic fund plan. You can do that. Yes.
Okay, great. Thanks a lot. Fred, anything to answer to that response? And I think we can get to the previous.
Just to mention that, as Roland said, it can be included in your proposal. And from the first round, there has been some countries that did include their NAPS as an activity in their application. and that was accepted. So having said that, if a country doesn't have a NAPS done yet, then you can include that as a particular activity. Just to say that use the JE or the SPAR or the IHR-PVS data to come up with a prioritized actions that would be sufficient to include. Thank you.
Okay, great. Thanks a lot, Fred. I see a hand up. We are not, taking questions live, but if you have any additional questions that haven't been answered, please go ahead and look at this website that's on the screen right now, WHESPP@who.int. Please go ahead and submit your questions there. We're pulling together a list and we'll get those questions answered for you, either about today's program, a previous program, or the programs coming ahead. Again, the email address is WHESPP@who.int. Happy to take and answer your questions. Also, you'll see a QR code there. Please take a moment, if you don't mind, with your phones and take a snap of that and go ahead and give us your feedback so that we can continue to improve upon these programs. I think if we don't mind just going back one more slide, thank you. Upcoming webinar schedules. You'll see ahead here, we'll skip a week due to some holidays in some parts of the world. And during the week of April 8th, it'll be April 9th, 10th, 11th, and 12th. I think we'll dedicate each day to a specific technical topic. I believe the 9th is dedicated to labs and surveillance. The 10th will be dedicated to health workforce. 11th, cross-cutting issues, some other things like gender equity, etc., that need to be inserted. And sorry, can you put up the slides again? I think I'm seeing those right now. And then the final Friday will be for implementing agencies. And then you could see, sorry, the schedule is gone right now, but we'll go ahead and share that with you for future programs. And please stick with us. If you have, again, any other questions or comments, please share them with WHESPP@who.int. And again, you could see the schedule coming up in April 16th, resource mapping, mobilization, monitoring and review on the 17th of April, and finalizing your proposal. So we're here with you throughout the entire pandemic fund proposal writing process. And again, we are working with our regional counterparts to ensure that these resources are made available in other languages. So with that, thank you so much for your time today, and thank you to the presenters as well. And we look forward to seeing you next time. Bye-bye.